everyone. This is Katie Watts with the National Center on Subsidy, Innovation, and Accountability. We're going to get started in just a couple of minutes since we still have lots of people joining. So we'll try and start at just about 2 o'clock Eastern. Welcome, everybody. This is Katie Watts with the National Center on Subsidy, Innovation, and Accountability. This is the error rate training for Year 2 states on conducting case record reviews for the error rate. And I see that some people are still joining, but I'm going to get started just with some introductions and some logistical items. First of all, I did send out an email to those who were registered, and that email contained a copy of the slides, it contained a copy of the data collection instructions, and it also contained a handout that I will be mentioning later in the webinar. If you did not get that email, you should be able to get those handouts from the GoToWebinar interface. If not, if you still can't get them and you would like a copy of those handouts, you can send me an email and I will follow up with you after the webinar. If you have any questions during the webinar, you can either raise your hand or enter a question in the Q&A box, and we will stop throughout the webinar to address anything that's come in. If you have any questions that you would like follow up on after the webinar, you can either send me an email or you can put your question in the evaluation that will pop up when the webinar is done. All right, so some introductions. I am going to be doing the presenting. Again, I'm Katie Watts and I'm the error rate lead with NCSIA. I do have a few of my colleagues on today. I see that Claudia Lamangi is on. She is an error rate specialist with NCSIA. I have Janae Williams and Mike McKenzie also on the slide. I don't actually think that they will be able to join us today because they are both traveling, but they are with us in spirit. And from the Office of Child Care Central Office, Adi Fatura and Linda Winings are both with me, and they are here to help with questions if there's anything that comes up where I need them to weigh in. I also see in the attendee list that we have several of our friends from the ACF regional offices around the country. So thank you for joining us. Again, this webinar is focused on case record reviews. All of you are in the Year 2 cohort, so it is that time where you are either conducting case record reviews or are going to be starting them soon. So I'm going to start out today's webinar by, one moment. Going to start out the webinar by just touching on a few important pointers, and these are just some things that have come up in our joint case reviews. We've gotten some questions on just a few various topics that I wanted to give some clarifications on. Then we'll dig in and go through the process of completing columns 2, 3, and 4 of the record review worksheet. And I have some examples, and you'll have, of course, a chance to ask any questions. We're going to spend a little bit of time talking about the additional inquiry and the mid-table, missing and insufficient documentation table, if you run into any of those types of errors. And finally, I will spend a few minutes on completing the element 500 of the record review worksheet, which is the summary element. We'll close out by sharing some TA support, technical assistance support that Nixia can offer. And actually, before I go further, there's one more logistical item that I wanted to mention. We have 90 minutes for this webinar. I don't think we will take the whole time, but I did not want to schedule just 1 hour because sometimes, you know, we go a bit over. So I wanted to build in plenty of extra time, but there's every chance that we will end before that 90 minutes are up. All right, so in this slide, I have a timeline for the year 2 cohort. The case review period ran from October of 2022 to September of 2023. That's the period from which you draw the cases that will be reviewed for the error rate. All of the year 2 states have submitted their sampling decisions, assurances, and fieldwork preparation plans, and I think most of them have been approved. And also most of the year 2 cohort has submitted their customized record review worksheets for approval. If you haven't yet, if your state has not yet submitted it, that's fine, but it must be submitted before the last day of December. The next line on the timeline is joint case review. And if you are a veteran of the error rate review process, you might remember that this is just a meeting when the staff from the lead agency gets on a Teams meeting with the central and regional offices as well as TA staff. And we will do like a live review of some of your completed worksheets. We like to do this just to see what kind of errors you're finding, how you're completing the worksheets, if you have any questions or problems with your reviews. So once you have started your reviews, you can kind of be on the lookout for some communication from us about getting that joint case review scheduled. The next error rate submission is the state improper payments report, which we also refer to as the 404 report. And the deadline for submitting that is June 30th of 2024. If your error rate is above 10%, then the state must complete and submit a corrective action plan. And that must be submitted within 60 days of the deadline for submitting the 404, which would be about August 30th of 2024. So as I mentioned, I wanted to start out the content of the webinar by addressing a couple of important pointers for conducting case record review. We wanted to address these now before most of you are starting your reviews. I know some of you have already gotten started. We'll be discussing first front end versus back end errors. So these are terms that you will often hear us using. What do we mean by them? You'll see at the bottom of this slide, I do have a citation from the data collection instructions. So if you would like to do some further reading on this, you can go ahead and reference the data collection instructions, and you will find this on the slides all throughout the rest of the webinar if you would like to do some further reading into it. So when we talk about front-end errors, we're referring to those errors that happen during the eligibility process. So this can mean something that occurs at eligibility determination, the initial determination, a redetermination, or subsequent case actions. These are the errors that are the responsibility of the eligibility workers or the eligibility agencies. And these are things such as the type of care authorized, the hours of care, or the subsidy amount that's authorized. And this is the focus of the error rate review. On the other hand, we have back-end errors, and these are not the focus of the error rate review. These are errors that occur after eligibility has been determined and the subsidy has been authorized. So these might include errors with issuing payments, time and attendance, or provider billing. If you do find an error in one of these areas during your reviews, you'll want to look into it, but it would not be considered an error for this review. Sometimes when we hold those joint case reviews with the lead agencies, we see back-end errors that are being counted as improper payments, and so we want to be really clear on which ones you would want to include in your review. I'm going to take a couple of minutes to do a little quiz on front-end versus back-end errors, and you can put in the QA box or chat box what your answer would be. So let's pretend that you are a reviewer and you have a case where the parent is working 40 hours per week and needs full-time care for the child, but the eligibility worker authorized part-time care. Is this a front-end or back-end error? Looks like I'm having a little bit of trouble seeing the question box for some reason, but it looks like pretty much everyone has said front-end. That's correct. This is a front-end error because it is something that occurred during the eligibility and authorization process. Thank you for everyone that weighed in. Next example, the eligibility worker correctly authorized full-time care, but due to an error in billing, the provider is only reimbursed for part-time. It looks like a few people have already, even before I read this out loud, said that this sounds like a back-end error, and that's correct. And the key thing here is the eligibility worker correctly authorized full-time care. So everything was done correctly on the front end. The issue occurred at the time of provider billing. Great. All right, let's do one more. Here, the family was responsible for a copay of $50 a month. The eligibility system incorrectly processed the authorization, leading to no copay being applied to the case. And this one is a little bit more ambiguous. I'm seeing some folks are saying front end, some folks are saying back end. So I want to walk through this one a little bit more. This is actually a front end error, and that's because it is an error that occurred at the time of eligibility, at the time of authorization. Even though the eligibility worker, might have input everything correctly, the error is still the quote unquote fault of the eligibility system. So it occurred prior to the authorization. That is considered front end. If you run into an error like this, and we have seen these types of errors, it would be something that you would want to count as an error for this review. Great job, everyone. Thank you for participating in the little quiz. And if you come up with any that are kind of ambiguous like that, feel free always to reach out to your regional office, and we can help a bit with determining, is that an error for this review, or is it a back end? Now we're going to touch on another topic that we've seen come up a lot in joint case reviews. And this is what to do when other entities, aside from the lead agency, is involved with eligibility. In many states, part of child care eligibility is carried out by entities separate from the lead agency. For example, perhaps provider licensing is handled by another department, or protective services might send a referral to lead agency for those cases, and the child is considered categorically eligible. In these cases, we understand that the worker from the lead agency isn't directly making the eligibility decisions. And sometimes we've seen that the lead agency doesn't actually have on hand the documentation related to the actions made by the other entity. And this might mean that parts of the record review worksheet either they can't be completed since they don't have that documentation, or the reviewer might just automatically say this is not an error because TANF took care of this and we're assuming that they did it correctly. There's a few things that we want to keep in mind about this. First, as I've said here, the lead agency is ultimately responsible for implementing the CCDF grant, and that does include the portions that are carried out by others. A written agreement between these entities is a regulatory requirement, and the portions that are carried out by other entities is still subject to the error rate review. For your reviews, those conducting must still be able to demonstrate that eligibility decisions that were made in part or completely by another entity is correct. Reviewers must be able to access any documentation. In your SDAP, there is an item about this, so it's something that should have already come up in your state and documented on the SDAP. So you might want to, take a double check that and make sure that you have a plan in place for getting this other documentation from other entities, if it is applicable. I know in some states it's a non-issue. But if there are any questions or concerns about being able to access documentation from other entities, again, we encourage you to reach out to your regional office for assistance. All right, we have a couple more pointers before we get into completing the record review worksheet. This next subject I want to touch on is replacement cases. As stated in the data collection instructions, replacement cases may only be used for valid reasons and only with approval from the regional office. We have had a few times where a lead agency has gone ahead and used replacement cases without getting that approval. So we wanted to remind you that just as soon as you believe a replacement may be required, please get in touch with your regional program specialist or regional program manager. And include in your request the number of replacement cases that you need, the months involved, and the reason or reasons that replacements are needed. And then once you have that approval, you can go ahead and review the replacement case or cases. one more slide in this section, and this is a big one. Personally identifiable information, or PII. We take the privacy of clients very seriously, and any information that can either by itself or in combination with other info, if it can be traced back to the client, that's considered to be PII. This might include, but not limited to, things like names, employer names and addresses, provider names and addresses, birth dates, of course, social security numbers, provider license numbers. So we ask that you please double check. Well, first of all, make sure that when training reviewers, that reviewers are trained not to use PII, and just when you're doing those second level reviews or checking over your worksheets, just make sure that there's no PII included anywhere on the record review worksheet. Many lead agencies have a cover sheet for their worksheets, and it's okay to have PII there as long as those are remaining within as long as they're internal only. So when you are communicating with OCC or sending us completed worksheets for your joint case review, just make sure that you leave those cover sheets off. And also make sure there's no PII in your file names when you're sending us worksheets for the joint case review. Receipt of PII is considered to be a reportable offense. So for us, again, it's something that's taken very seriously, and we really appreciate cooperation to protect your client's privacy. Right, I didn't see any questions or hands up. If you did have any questions on the previous section, go ahead and you can enter them now, and I'll try and address it before we move on to the next slide. But at this time, we want to switch gears and get more in depth into conducting case record reviews. Specifically, we're going to discuss how to complete columns 2, 3, and 4 of your record review worksheets, and I'll show some examples. And there are lots of additional examples available in the data collection instructions. And again, I do have citations for the data collection instructions on each of the slides. One more thing just to keep in mind is that the lead agency customizes your record review worksheets, so your worksheets are not going to look exactly like these examples that I'm showing you. They're just hypotheticals. Before I jump in, I did get a question that came in. And that question was, do record review worksheets get submitted to you? Good question. I know I mentioned, sending us worksheets in the last slide. And the answer is that some of your worksheets do get submitted to us, to OCC for the joint case review. When you're ready to hold the joint case review, we'll have a planning call where we'll discuss more of the logistics. But basically, you will send us a number of your completed worksheets for that joint case review. You definitely don't send us like all of your worksheets. It's just a sample. And also sometimes the state might send us one of the completed worksheets if they have a question on it. So that's kind of what I was referring to in the last slide. One more question that came in, actually I got a couple, from Melanie. Is a confidential case a replacement case? Melanie, we can talk more about this offline, or if you want to speak up and give some more information, because I know confidential case can mean different things in different states. But broadly speaking, it's usually not, unless for some reason that case is inaccessible. Usually replacement cases are either those that for whatever reason they haven't had a payment made, or the reviewers, the lead agency, cannot access them for some reason. All right, and yeah, Melanie, if you have any further questions on that, we can definitely talk offline. One more question, Robin. If after eligibility a family changes providers, at that point an error is made, is that a front-end error or back-end error? I might want a little bit more information on exactly what happened, but usually if a family change providers, if that makes, has any changes to the authorization type of care, the eligibility worker process that provider change, that's all going to be front end. If for some reason, like on the back end, a payment went out to the wrong provider, that's going to be a back end error, if that makes sense. Again, is it something that happens that is affecting the authorization, or is it the authorization happened and then the error occurred after the fact? Robin, does that help? If not, feel free to speak up too, and we can address that more. All right, I think that's it for the questions right now. So I'll move on to the next slide, and we'll stop again. If there's any more questions that come in, we'll stop in a few more minutes. So in this section, again, we're going to walk through completing columns 2, 3, and 4 of the worksheet. We're skipping column 1 because column 1 is just the boilerplate and the policy citations. The reviewers do not actually add anything to those columns, they just read them. Column 2 is the analysis column, and this generally includes a number of items that are customized to conform to the state policies and procedures. When completing column 2, be sure to answer all items unless you can't answer them because either they're not applicable or because you don't have enough information to answer them. If you have a comment box in your column 2 in the different elements, we encourage states to make liberal use of them. And I have listed here some reasons to use the comment box, some ways to use the comment box. If there's an error, you can describe it. You can show your math. For example, when you're calculating the subsidy amount in element 410 or income. You can record the documentation that was used to verify the requirements for the element if you don't already have items in the element that ask that. Or just note, anything else that's not captured by the items in column 2. And if there's really nothing additional, to say, you don't have to have comments, it's not required. We certainly don't need you to reiterate what you've already, said from the items. And as I said a couple slides ago, we really want to hammer this point home, is to avoid PII in your analyses. I have a couple of examples that I'll show over the next few slides, and there's 2 examples and I'm going to go back and forth between them as I complete the different columns. This first example shows element 310 with no error. We're going to focus on column 2 again. The first item, the reviewer checked yes. This is the residency element, I should have said that. The first item, the reviewer checked yes, since it was determined that the parent is a resident of the state. Below that, there's a couple of items about verification of residency. with instructions for the reviewers to answer based on the date of the case action, since there was a policy change. The reviewer answered the first of these items and left the second one blank, based on, again, the date of the case action. And in the comments box, the reviewer recorded the documentation that was reviewed to verify residency. And you can see that this one item was left blank. The comments box was used here because there was no other place to document what was used to verify the requirement. The next example shows element 100, and here there is an error. Element 100 is the application and redetermination forms. Going down the column, the reviewer ticked yes, that there was a signed application in the case record. The next question is, are all the forms correct? And they answered no. We'll get into that more in a moment. And the next two items are on asset declaration and is there a current service authorization? And the reviewer answered yes for both of those. The reviewer here used the comment box to describe the error that the fourth page of the application had a couple of incomplete items. So in this example, I show another way to use the comments just to say what the error was to give some more information on that. That was column 2. We'll move over to column 3 now. Here the reviewer summarizes the findings from column 2. No new information should be presented in column 3. We're just going to summarize what we already know. We'll discuss column 4 shortly, but the reviewer should be able to complete column 4 just by looking at the information given in column 3. There are a couple of things that should always be included in column 3. We always like to see, was it an error? Was the element an error? And if so, what kind of an error was it? Was it a payment error or non-payment error? And was it caused by missing or insufficient documentation? If there was an error, you can state a little bit of information about what the error was, but try and keep it concise. You don't need to reiterate what you've already said in column 2. And don't present anything new here. The column should never be left blank, even if there was no error. If there was no error, then you can just state that, as shown in this example. You don't need to say anything more, but again, just make sure it's not left blank. And in this slide, this shows what column 3 might look like when there is an error. So again, this is the same example that I showed you a few slides back, where element 100 had some incomplete items in the application. And in this state, that missing information means that there was an administrative or non-payment error. And again, we're not saying that this is necessarily going to be the case in your state. We know that in some states, having some incomplete items on an application might not be an error, or it might be a payment error. Just in this example, we're going to say that it was administrative. So looking at column 3, the reviewer stated that there was an error. It was caused by missing or insufficient documentation, and it was an administrative error. And there's a few more words just about kind of the nature. There were some incomplete items on the application. So this is perfect for column 3. As you can see, it includes everything that we would need to see. And as we talk about column 4 in a minute, the reviewer would be able to code column 4 just based on this sentence here. And before I get further into column 4, I wanted to take a look at a question that came in. Oh, okay. Yeah, there's a couple questions here from Frank. Are comments required for column 2? And then if there's no errors in the elements? And let me just pull this up one more time just so we can all take a look at column 2. Frank, the answer to your question is no. Comments are not always required in column 2. If there's really nothing extra that needs to be said, then it's totally fine to leave the comments blank, especially like if there's no errors, there's already a place in the column to record the documentation that was reviewed, then it's fine to leave the comments blank. You definitely don't need to, reiterate what's already been said just so that you have something entered in the comments. All right, you're welcome. Didn't see any other questions at this moment, so we'll stop again in a little bit if anything comes in. But let's go ahead and talk about column 4. And this includes a number of items about the findings for the element. So it's kind of similar to column 3, but instead of giving a narrative version, you'll be using a coding scheme. The first item asks whether there was an error, and you'll code either 0 if there was no error and 1 if there was. Item 2 asks whether there was missing or insufficient documentation. If there was no error, then you would code NA. And if there was an error that was caused by missing or insufficient documentation, you would code Y. And you would code N if the element did have an error, but it was not caused by missing documentation or insufficient documentation. So this seems straightforward, but believe me, we do see quite a few coding errors. So, you can feel free to refer to the DCI, or also the coding scheme is printed at the bottom of the record review worksheet. So you can always refer to that for a quick refresher. The last item in column 4, this is actually only in elements 100 through 400. It's not in 410. This is 2A. And this one you actually leave blank if there was no missing or insufficient documentation error in the element. You would only answer it if there was a mid-error. If there was one and it would result in an improper payment, or IP as I say here on the slide, then you would code that as Y. And if there was a mid or missing documentation error, but it would not result in an improper payment, then you would code N. So I'm going to show this in a few examples, what this looks like. Our first example shows no error in element 310. Taking a look at column 4, the first item is coded as 0 because there was no error in the element. Item 2 is coded as NA since there was no error. We do see when there's coding errors here a lot of times, this item is coded as N, but there was no error in the element. So item 1 is coded as 0, item 2 is showing as N, and it should be NA when there's no error, not N. And note that 2A is left blank. 2A is always going to be left blank unless item 2 is coded as Y. And in our second example, this one shows a mid or missing or insufficient documentation administrative error. We're going to complete column 4 first by coding item 1 as 1 because there's an error in the element. The error was caused by missing or insufficient documentation, so the reviewer enters Y for number 2. And because the reviewer entered Y for item 2, they would go on to code item 2A. Since we know that this is an administrative error, you can see that from looking at column 3, it's not something that would result in an improper payment. Item 2A was coded as N. If this had been an error that might result in an improper payment due to that missing documentation, then the reviewer would have had to gone and use the mid table, as it's stated here in the instructions for item 2A. So in the next section of this webinar, we will be taking a closer look at the additional inquiry and the mid table. To start, I want to take a step back and give a kind of a crash course on the different types of errors that we look at in this review. And I've already used these terms a little bit when showing the different examples over the last few slides. But when a case file has an eligibility error, it's going to fall into one of 2 categories. There are those that are caused by missing or insufficient documentation, or MID, and then there are the non-MID errors, which would be any other type of error, such as income miscalculation, applying the wrong copay, or other misapplications of policy. Then the MID errors can be broken down further into 2 types. There are the errors that cause improper payments, and then the errors that do not cause improper payments, which we sometimes refer to either as administrative or non-payment errors. And the non-MID errors can also be broken down into either improper payments or administrative. When we think about the MID table and the additional inquiry, we're focusing on just this one type of error, and those are the MID errors that could cause improper payments. When we talk about the additional inquiry, this is the process by which those MID errors that potentially cause an improper payment could be mitigated for this review if you are able to somehow demonstrate that despite the fact that there was missing information, the child really was eligible for services. The MID table is part of the record review worksheet. It's in the template between elements 410 and 500, and it's used to record some of the data on those MID potential improper payment errors, regardless of whether an additional inquiry was conducted. The table's broken down by element. If you do not have any MID potential improper payment errors, make sure that, and this arrow is showing the wrong thing, sorry. You can see kind of at the top of the MID table template, there's a little line there that says child ID. That's where the arrow should be pointing. If you did not have any MID potential improper payment errors, make sure that you do fill in that child ID at the top of the page, but you can go ahead and leave the rest of the table blank. However, if you do have one or more of those potential improper payment errors caused by MID, then you would go ahead and fill out the table by referring to the element with an error. And I'll show you an example in a few slides. There are a number of steps to completing the mid-table, and step one is just to determine whether an additional, to determine whether the element has a mid-potential improper payment error. And step two is that if there is a mid-potential improper payment error, is there an additional inquiry that can be conducted? And if so, step three is to conduct that additional inquiry. Step four is to fill in the mid-table for the applicable element. And remember, this is done for any mid-potential improper payment error, regardless of whether an additional inquiry was conducted. Finally, step five is to go back to the element and update with any new information that was found through the additional inquiry. Let's go through these steps in a little bit more detail. Step one, again, is to determine if the element has a potential improper payment error caused by MID. And here, this is where it's really important for the reviewers to have a consistent understanding of your policies and procedures and error definitions. What might make a case ineligible versus what is just considered an administrative error. To illustrate this point, consider the example I'm going to show you on the right. While looking at element 400, the reviewer discovered that hard copies of the pay stubs were missing from the file. However, the income information is available in the state system. So if you are a reviewer, just kind of think about what this might be in your state. In some states, it's a non-issue because maybe everything is scanned into your system. You don't deal with hard copies. In other states, it might, maybe hard copies are, a thing, but as long as they're in the system, then it's not going to be considered an error. In some states, it might be considered an administrative error, and then in others, it might be considered a potential improper payment error. And if you are a reviewer, again, you need to, make sure that you have an understanding here when you run into situations like this or, similar situations. Is this a case where it's a potential for an improper payment? And if so, then you would need to go ahead and complete that mid-table. And here's a few more examples on considering whether something is a mid-potential improper payment error. And if you want to play along, just like we did earlier in the webinar, you can use the questions box to answer the question. Let's look at, this is first example is element 340. The case file is missing a school schedule to support hours of care. The reviewer contacts the local eligibility office and they find the missing schedule. Is this a mid-potential improper payment error? Right. No. I see a couple of people saying no, and that's correct. This is not a mid-potential improper payment error. Initially, the reviewer might have thought it was, but really the documentation was in the hands of the local eligibility office the whole time. It just didn't get forwarded to the reviewer for whatever reason. Reaching out to the local eligibility office is not considered an additional inquiry. It's just, considered part of the normal review procedure. What about the second example? In element 100, the application is missing a signature. According to the state's policy, the missing signature would not result in an improper payment. Is this a mid-potential improper payment error where a mid-table would need to be used? I see a couple of no's and a couple of yeses. Right, so this is, again, another case where it's not a mid-potential improper payment error. And I think I say here in the wording that it would not result in an improper payment. If you're missing some documentation, but it would only be considered an administrative error, then you do not need to complete the mid-table. What about this one? In element 400, there were missing pay stubs, which would cause an improper payment, and an additional inquiry was conducted. So is this a case where the mid-table would need to be completed? Yes. Good. There was something missing that would cause an improper payment, and an additional inquiry was completed. Here, the state or the reviewer would need to complete the mid-table. And in element 320, employment verification was missing, which would cause an improper payment. An additional inquiry was not conducted. So would the mid-table need to be completed here? Yes. Good. Seeing a couple of yes responses, and that is correct. So even though even though there was no additional inquiry done, the mid-table would still need to be completed. This is still a mid-potential improper payment error. Great. And I know some of these examples are pretty straightforward. If you do run into one in your reviews that isn't so straightforward, you can always reach out to us and we can help with determining if the mid-table needs to be filled out or not. In this example, while reviewing element 320, it was determined that there was a mid-potential improper payment error. And this is what the reviewer did. First, you'll see that the first item in column 2 was left blank. The reviewer couldn't answer that question because there was missing information. The second item was answered as NA since it was not a 2-parent household. And the third item, is the required documentation needed to verify the need for service in the file? And that was answered as no. The reviewer described the error in the comments. They said there was missing work verification for the parent. Column 3 was completed, including the description of the error type. And then let's take a quick look at how column 4 was completed. Item 1 was coded as 1 because there was an error. Item 2 was coded as Y because it was mid. And 2A was also coded as Y because that mid error could potentially result in an improper payment. The next steps to completing the mid-table are to determine if an additional inquiry can be conducted, and then to conduct the additional inquiry, if applicable. Resources utilized for the additional inquiry, they can really be any resources that are within the state. So for example, you might consider checking any electronic systems or shared screens. You can try and reach out to other assistance programs in which the client has participated, or other state agencies, vital records, employment, just anything that's kind of within the state. The reviewers may not do the following for the additional inquiry. First, contact local eligibility offices to provide missing information. And to be clear, this is allowed. It's not, the reviewers can do it, it's just not considered additional inquiry. And also do not seek independent verification. Don't reach out to the client, employer, or provider as part of the additional inquiry. The bottom line is to keep it within the state. Once the reviewer has considered whether an additional inquiry can be conducted and then gone ahead and conducted it if applicable, then complete the mid-table. And in our example, the reviewer actually did go ahead and complete the additional inquiry. First step is to enter the child ID. And like I mentioned a little while back, this actually does need to be done whether or not the rest of the mid-table is filled in. So in all 276 of your worksheets, that child ID should be entered on this page. When filling out the mid-table, first you're going to just refer to the right row that corresponds with the element that had the error. In this case, it was 320. In column 2, describe what documentation was missing or insufficient. In this case, it was missing work verification. In column 3, enter the dollar amount of the potential improper payment. In most cases, this is equal to the sample month payment amount. Sometimes we do see partial amounts here, but usually it's the full sample month payment amount. Column 4 asks, is there an additional inquiry that can be made to mitigate the potential improper payment error? Here we code this either 0 if no and 1 if yes. If you've determined that there is no additional inquiry that can be conducted, then you need to complete column 5 here. And you can just say just a few words or a sentence about why you cannot complete an additional inquiry. And at this point, you'd be done. You do not need to complete 6 through 9. If you do conduct an additional inquiry, you would leave 5 blank, column 5 blank, and then you would complete column 6, describe what you did for the additional inquiry. Column 7, you would code 0 or 1 based on whether the additional inquiry was successful. In column 8, enter the dollar amount that was mitigated. And in column 9, describe how the state determined whether or not that improper payment was mitigated. And again, a few words is all that's needed here. In some states, for various reasons, they can never conduct additional inquiries. There's just no ways in which those can be conducted. And if that's the case for your state, in that column 5, you can just say that we can't conduct additional inquiries for XYZ reasons, and you can just put that in any mid-table that you need to complete. All right. And finally, complete the bottom row, which is the total. If you did have a successful additional inquiry, the last step in the process is to go back and update the element with any new information that was found. Here, the reviewer went back to element 320 and changed the answer for item 1. It was blank before. Now they've entered yes. It was determined that the parent did meet a need for service. The third item down was left as is because that documentation was still missing from the case file. even though they were able to, show that the parent did meet the need. And the comments were also updated just to say that the verification was, that they were able to verify through additional inquiry. And similarly, column 3 was also updated. Column 4 was left the same because, again, even though there was a mitigation, the information there was still missing. The case did still have a potential improper payment error, even though it was in the end mitigated. I have one more example I wanted to quick show, and then I will address, I think there's been one or more questions that's come in. But I wanted to show this mid-table with multiple errors. Sometimes the case might have more than one error caused by mid. Even multiple elements can be affected by the same piece of documentation missing. In this example, a lead agency found that the file was missing work verification, which affected 320, and a work schedule, which affected 340. In element 320, this is the same as in a couple slides back, the lead agency was able to mitigate the error by contacting TANF, and they provided the proof of employment. In element 340, the lead agency also reached out to TANF, but they did not have the work schedule, so this element was not mitigated. And I wanted to note how the totals row is completed when there's multiple errors in the mid-table. Starting with column 3, the total amount of potential improper payments is 155. So you'll notice this is not like a straight addition. It wasn't 155 plus 155. You want to consider what was the total amount of potential improper payment for the whole case. And here it's just the sample month payment amount, which was 155. Column 4 is a simple addition. There were 2 times where an additional inquiry was made. Column 7 is also a straightforward calculation. This column asks, was the mitigation successful? And it was successful for one of the elements. So the reviewer would add those 2 rows up and get 1. Column 8 of the totals row is a bit tricky when there are multiple elements affected. And again, we just ask the reviewer to kind of look at it, what was the outcome of the additional inquiry for the whole case? And in this case, again, we have one element that was mitigated and one that was not. And because that work schedule was still missing in the end, the whole case is still considered in error. The improper payment was not mitigated because that work schedule is still missing. Couple of questions. So this first question, can the local office reach out to the client or employer? And for the purposes of the error rate review, no, they can't. All right, how do you get the amount of the column 3 on the mid-table and for element 320? I think you are referring to the amount in column 3 is for element 320 is 155. In most cases, I think I mentioned that it's going to be the same as the sample month payment amount. Usually when there's missing documentation, it's going to affect the whole case and cause a complete overpayment. So in this hypothetical, I just made up that number that sample month payment amount was $155. I think I mentioned too that sometimes we do see partial amounts here where the missing documentation would result in just a partial overpayment. So if that's the case, that's something that the reviewer would need to kind of figure out what would be the actual amount of the potential improper payment. And again, that is something that we can help with if needed. Right. The last portion of the webinar is on completing element 500 of the record review worksheet. And this is the end. We've made it to the end of the record review worksheet, element 500. That's the summary element. The reviewer is going to summarize the findings for the entire case. And unlike, unlike the other elements in the worksheet, 500 only has 2 columns. In column 1, summarize the entire case in a narrative format. So it's similar to how a reviewer would complete column 3 in the previous elements. You want to focus on if there were any errors that were found. If there were no errors, then you can just say no errors. This case summary can be brief. Column 2 of element 500 includes a number of items, some of which utilize a coding scheme again. And I want to start out by walking through just items 1 and 2. Item 1 asks if there was an error or not. If there were no errors in the case, then you would code 0. And if there were any errors, then you would code 1. Item 2 is titled Missing or Insufficient Documentation. If your case did not have any errors, then this would just be coded as NA. And if your case only had 1 error in it, then you would code Y if that error was caused by MID, and N if the error was not caused by MID. This can get a bit tricky if the case had more than 1 error. And this is where I sent out a handout before the webinar in an email, and it's also available in the GoToWebinar dashboard. And this handout is actually all about completing item 2 it's all about completing item 2 in element 500. There's kind of a hierarchy that gets utilized here. If there were multiple errors in the case, but there were any payment errors caused by MID, or if there were no payment errors, but there's at least 1 administrative error caused by MID, then you would code Y. Otherwise, you would be coding N here. So I know it's a little bit confusing, and I'm going to show a couple of examples. But again, I would recommend that if you do run into a case where there's multiple errors, you can refer to that handout that I sent to help with coding this. It's kind of, like I said, a hierarchy where the payment errors are taking priority over the non-payment errors when you are coding this. First, I'm going to show a more simple example of completing 500. And I just wanted to show that again, in the first column, if there's no errors, then you can just say that for the summary. You don't need to go ahead and summarize every single element, what was found. And right here, I just want to focus on these first 2 items, how to code those. Item 1 is coded as 0 because there was no error, and item 2 is coded as NA. For example 2, in column 1, the case file was missing the required residency verification, but it was mitigated using the additional inquiry. You can see that in the case summary, the additional inquiry and the MID table were cited here. And since it was mitigated, there was no improper payment, and no other errors were found in the element, or in the whole case, sorry. Moving over to column 2, item 1 is coded as 1. The case still did have an error since that residency verification was missing. Even though the improper payment was mitigated, there was still an administrative error. Item 2 was coded as Y, again, because of that missing verification. One more example. This is an example where there are multiple errors. Let's take a look at column 1. This case had an improper payment error found. Incorrect copay was applied. Elements 400 and 410 were cited. And there was an overpayment of $25. There was also, if you look at the next paragraph, there was an administrative error in element 100 that was caused by a missing form. Going on to column 2, item 1 is coded as 1 because there were errors in the case. Item 2 is coded as N. So this case did have a mid error, but the payment error in the case in element 400, that was not caused by mid. So again, the payment errors are kind of taking priority here over the non-payment errors. And because the payment error was not caused by mid, we're going to code this as N. All right, let's address the last items in column 2 of element 500. There's a series of items 2A through 2E, and these are all about the mid-table and any additional inquiries. And I'm not going to read through these all now. I'll show you some examples. But basically, all of the information that you would get here can be pulled from a mid-table for that case. Item 3 in column 2 of element 500 asks if there was an overpayment or underpayment. You would enter NA if there was no improper payment, O if there was an overpayment, and U if there was an underpayment. Item 4 asks for the total amount of any improper payment. And you can just, if there was no improper payment, you can just enter 0 here. And item 5 is asking for the total payment amount for the sample month. So let's go back to the few examples that I showed in the last few slides and finish those. The first example, again, was a case where there were no errors. And because there were no errors, there was no mid-table that was completed here. So 2A through 2E are all just 0. Item 3 is coded as NA. 4, the reviewer entered $0. And 5 is the payment amount for the sample month. In this slide, I returned to the example where there was an additional inquiry that was conducted. So I'm going to show you how 2A through 2E are going to be completed here. 2A asks for the number of mid-potential improper payments that were identified, and that's 1 in this example. In 2B, the reviewer entered the total amount of mid-potential improper payment errors, so the dollar amount, which in this example is $175. 2C is the number of times that an additional inquiry was used. Here it's going to be 1. And 2D is the total number of times the additional inquiry mitigated the potential improper payment error. Since this mitigation was successful, the reviewer enters 1. And the total amount of improper payments mitigated was $175 in this example. So basically, any time that a mid-table was completed, you need to complete 2A through 2E. Otherwise, this can just all be entered as 0. Moving on to item 3, because that additional inquiry mitigated the potential improper payment, this can be coded as NA. There was no overpayment or underpayment. Item 4 is $0, and the total payment amount of the sample was entered for item 5. All right, last example. Here we did have an improper payment. There were actually 2 errors in the case. One was an improper payment error and one was an administrative error. The improper payment error was not caused by missing documentation. The mid-table was not complete. So 2A through 2E are all 0. There was an overpayment, so the reviewer entered O for overpayment. And in 4 and 5, the reviewer has entered the total amount of the improper payment as well as the payment amount for the sample. All right, so that's the end of my examples here. I had quite a few questions that have come in, so let me make sure I get everything. I want to make sure I heard correctly. If the reviewer can ascertain the information from a state system, is that not considered an AI? All right, so the question is, is looking at the state systems an additional inquiry? I mean, generally, yes, that would be considered an additional inquiry. It's kind of up to the state how they want to look at it. If the information was always there in the system, and you consider that to be part of the file, then no, that would not be an additional inquiry. If it's not really something, if you're kind of, how do I say it? If you're kind of looking beyond, what would normally be included as part of the case file in the system, then I would say yes, it is an additional inquiry. The states do have kind of a lot of flexibility in determining what is the additional inquiry and what is just kind of normal procedures for finding information. Next question, a case should only be marked an error if it was an error at eligibility. So in this review, we're looking at errors that took place during eligibility determination, redetermination, as well as subsequent case actions. So if there was like a change in income or a change in employer. Those are all what we would call front-end errors, and yes, that was what we focus on in this review. If it's an error that happened after the authorization, that kind of has nothing to do with, the eligibility determination or subsequent case actions. So payments, time and attendance, provider billing, all of those things are not considered errors for this review. And one more question. This is about element 500. Okay, so you're asking that if like the mid-table was not completed, can items 2A through 2E just be left blank? We do like to see the zeros there. I think in the past we've kind of been a bit lenient on that, but we do want to make sure that we do like to see every item get coded. I know it's kind of like a lot of extra busy work just to fill in 0, 0, 0, 0, 0, but again, we just want to make sure that the worksheets are all complete. Nothing was missed. Thank you for all the questions. That's good. So this slide just shows some of the TA support that NCSIA can offer. Just kind of basic TA that we can offer is if you have any tricky cases that you come across, any questions, you can reach out to your regional office. A few other things that we can do, if you are a state that has not yet submitted your record review worksheet template and you would like us to take a look at it, provide some feedback before you officially submit, that's something that we can do. Once you've started conducting your reviews, if you want us to take a look at some of your completed worksheets, again, just to make sure that the coding is all correct, that the worksheets are being completed correctly, again, that's another thing we can do. And I mentioned at the beginning of the webinar about the joint case review. We like to hold a planning call for that joint case review relatively soon after your worksheet has been approved, after the customized record review worksheet has been approved. The actual joint case review call is held about when you've completed about 3 months of your case reviews. So that's another thing you can look out for, is just communication from your regional office about getting that scheduled. There will be an evaluation that will come up as you close out of GoToWebinar. Really appreciate if you can take a few minutes to complete that. And if you do want, if there's any other questions or want to request any follow-up technical assistance, you can let us know on that. But otherwise, I think that's it for questions that have come in here. So I will hang out for another couple of minutes if you want to speak up or enter another question. But otherwise, thank you so much for participating, joining in, listening in. I hope this was helpful. Look forward to working with all of you as you conduct your reviews and complete this process, and have a wonderful, wonderful holiday season. Thank you very much, everyone. Take care. Bye-bye.